Good day, class. In this video, we are going to talk about the Chi and Blood differentiation. This is slightly different to the Zangfu differentiation. From the Chi and Blood differentiation method, we don't locate the specific organ, but rather we try to identify the disorder of Qi or blood and what kind of disorder. The Qi deficiency. The Qi syndrome many can be categorized into deficient and excess syndrome. Firstly, the Qi deficiency. The patient may present as tiredness, fatigue. The Qi deficiency, the fatigue will be worse after movements. That's what we said about Qi deficiency, such as the pale complexion, dizziness, vertigo, reluctance to talk, spontaneous sweating, tachypnea, pale tongue, a large tongue with teeth mark, a thin, weak, and forceless pulse. In treatments, we're going to tonify the Qi. We can use acupuncture with reinforcing technique and also Moxibustion to tonify the Qi. We can use room 4, 6, 17, bladder 13, 20, 23, and stomach 36. And then we also can use the specific Zangfu organs, especially the back-su points of specific Zangfu organs. You also can refer to the previous slides of Zangfu syndrome differentiation, such as the spleen Qi deficiency, the kidney Qi deficiency, the lung Qi deficiency. Which points are we going to use? What kind of manifestations do the patient have? Then you can combine, you can choose some of these points. These points, we don't use all of them at the same time. You can choose. Room 17, 膻中, is the Qi meeting points in the chest. Bladder 13, 20, 23, 肺腧, 脾腧, 肾腧, the lung, the spleen, and the kidney. These are very important for the Qi. So we can use acupuncture with reinforcing technique or the Moxibustion. Qi sinking. That's the next stage of Qi deficiency. The Qi need to control the organs in specific location. Not as specifically have to be the organs. Qi need to support everything. This everything includes the sweat, menstruation, internal organs, tissues. So for Qi sinking, the patient may present as diarrhea, the support from the large intestine, the chronic diarrhea, lost control of the blood, of the urine, lost control of the menstruation, excess menstruation, the collapse of the organs, collapse of the anus, uterus, pale tongue, white coating, deep, weak, and forceless pulse. In the classic, in 黄帝内经, it described that something moving downwards, we use Moxibustion. So for Qi sinking, although we can use the combination of acupuncture and Moxibustion, we're going to focus on Moxibustion. We can choose that the points can tonify, and then we will use Moxibustion. Do 20, room 8, room 6, room 4, room 12, bladder 20, 21, 23, stomach 36. U20 on top of the head, that's the highest part of the body. The prolapse, especially the uterus or the anus. You can use U20, that's the application of the treatment principle. We're going to treat the upper part of the body for the disease in the lower part of the body. So in the treatments, we got several principles. We can treat the low part of the disease in the lower part of the body. We're going to choose the points in the upper part of the body. Sometimes we also can choose the points on the left side to treat the diseases on the right side. Severe condition, Qi collapse. Restore the yang. Qi collapse, you need to think about what symptoms or manifestations the patient may have. Qi collapse may be followed or be followed by blood deficiency or excess blood, loss of blood. As these two are related because the relationship between the qi and blood. We're going to strengthen the qi. You can use above points. We can add acupuncture for U25, 26, room 1. When severe qi collapse, the patient will present as unconsciousness or the blood pressure, the drop of blood pressure. So we're going to use U26. So we have mentioned when we study the U26. U26 is very important for emergency, especially for the unconsciousness. When we talk about qi stagnation, think other symptoms that's in the Zangfu organs, such as the liver qi stagnation, the lung qi stagnation, the qi stagnation of the spleen and stomach, what kinds of manifestations the patient may present. So we're not going to go through again. The treatments, we're going to focus on acupuncture because this is an access syndrome. We're going to use a reducing technique. We can choose room 12, 17, large intestine 4, level 5, level 14, Sanjia 6, GB 34, 36, 37, 39. 37 and 39, stomach 37 and 39. These are the low C points of large intestine and the small intestine. The qi counterflow means that the qi doesn't move in a normal direction. The lung qi is counterflow. The patient may present as cough, tachypnea. The human principles of the counterflow, we need to recover the function of the organs. For the lung, we're going to use acupuncture, reducing technique. You can choose lung 1, 7, lung 9, lung 6, room 17, 13, and 36. For stomach qi counterflow, the patient may present as nausea and vomiting. Same acupuncture, reducing technique, room 12, 21, pericardium 6, 17, 36, and 30. Blood syndrome can be categorized into 3 categories: the blood deficiency, blood stasis, and bleeding. Blood deficiency, we have mentioned in the previous video, the liver blood deficiency. So you can have a look the symptoms. We also have introduced the heart blood deficiency. So when you study the therapeutics, If you don't remember these manifestations, go and check in the diagnostics, in the basic theory. We have very detailed discussion on these manifestations. The treatments, we're going to tonify the blood and the qi, because the blood deficiency, also for bleeding, it's the blood. We cannot create the blood immediately, but what's important, we need to confine, we need to recover the confining function of the qi in order to stop bleeding, in order to create the blood. We need to tonify the qi. So the common use points, we're going to focus on the blood and the qi. So we can use spring 10, room 4, room 17, GB 39, spring 6, summer 36, blood 15, 17, 20, 18, 43. Blood depends on different causes. It can be trauma, heat stagnation, or coldness. No matter what kinds of cause, it results in the poor circulation of the blood. The patient may present as the stabbing pain in specific area and do not like the pressure. In female, the patient may present as the pain before the period or during the period. They also can see the blood clots in the blood. The tongue can present as the purple tongue or the purple spots on the tongue. The treatment principles. The treatment principles will be activating the blood, and how to activate the blood, we also need to think about the causes. But from Chi stagnation, you're going to activate the Chi stagnation. For the coldness, you're going to relieve the coldness. So the treatment principles, we're going to activate the blood, removing the stagnant blood, stopping pain, reducing the swelling. The treatments quite different in different stage. Initial stage, we're going to use acupuncture only. Prick for bleeding. In the later stage, we can use the combination of acupuncture and Moxibustion. The initial stage and the later stage mainly refers to the acute stage or the chronic stage, because the bloodstasis also may present in the chronic bloodstasis as chronic bloodstasis. We can use spring 10, 17, spring 10 from the name, the sea of blood. 17 格书 the meeting points of the blood. 人 4 气海 the sea of the qi. So for bloodstasis, to activate the circulation of the blood, how to activate? We need a qi. The activating function of the qi. That's why we use 人 4. 人 17 is the qi meeting points in the chest. It's also we are focusing on the qi. Level 4, level 3, again, we use the combination of these two as a pair can activate the circulation. You can use R4 points, especially for stopping pain. Bleeding syndrome. To treat the bleeding syndrome, we need to identify the causes. Due to deficiency or due to excess. Deficiency, qi deficiency. We're going to tonify the qi. So we can use the combination of acupuncture and Moxibustion. Many focus on the qi deficiency syndrome, and then we can add the spring 1 and lung 6. For bleeding, the excess heat, you need to clear the heat. Stop bleeding. How to stop bleeding? Because this is the heat, so we need to cool the blood. Use acupuncture, no Moxibustion. From this slide, you will see that for different type of bleeding, we actually choose different points. but we mainly focus on specific organs, such as the coughing blood, lung 1, 5, 10, 6, and blood 17. Blood 17 is the meeting point of the blood we have mentioned quite a few times. In the heavy menstruation, we also can use blood 17. Bleeding due to deficiency with deficiency heat. We're going to use acupuncture only. We don't use Moxibustion. Round 12, 10, 5, kidney 3, bladder 13, and 43. Bleeding due to blood stasis. We need to activate the blood stasis, so the treatment will be same as the blood stasis. Sorry, the common points will be same as the blood stasis. The Chi and blood are always related, so the Chi syndrome are always accompanied by the blood syndromes. The Chi deficiency may result in blood deficiency. Blood deficiency also may result in Chi deficiency. The treatment will tonify the Chi and blood. We can use Moxibustion and acupuncture. Room 4, spring 10, 17. Room 17, bladder 20, 21, 18, 17, GB 39, and summer 36. Blood collapse due to Qi deficiency. Then it will, because the cause is Qi deficiency, so we're going to use the same as the Qi deficiency. Qi collapse due to excess bleeding. This is the first cause. The root cause is excess bleeding. Urgently tonify the Qi and blood, restore yang. Bleeding. It is impossible, especially in the past. Now you can, in the hospital, you can put the blood in the body from the drips. But in the past, there's no way to create the blood in very short period. So what's very important for bleeding, we need to tonify the qi, restore the confining function of the qi, restore the yang. Once the yang qi restored, it can limit the bleeding. That's why we focus on Moxibustion. We can use round 8, round 6, round 4, do 20, 36, depends on the situation. If in an urgent stage or emergency, such as unconsciousness, you use acupuncture. Do 25, pericardium 6, stomach 36, spleen 6. So for bleeding, tonify qi is very important, especially for excess bleeding. Firstly, stop bleeding and tonify the qi. Tonify the qi when you use the acupuncture, we're going to focus on Moxibustion. If you use herbal medicine, you can focus on Huang Qi, a large dose of Huang Qi. Huang Qi also quite commonly used in homeopathy, I think, because I have seen some of you use these herbs. Blood stasis due to Qi deficiency. You're going to tonify the Qi, so always treat the cause and then relieve the manifestation. Activate the Qi circulation, activate the blood circulation. The last two syndromes on the Qi and blood conditions are blood stasis due to blood deficiency, Qi stagnation with blood stasis. These two are not difficult syndromes, so we are not going to explain in details. And also, these points, many of them we have explained quite a few times. So I want you to try to explain from the function, the characteristics of the points, why we use these points. And also, I want you to think about what's the relationship between the blood stasis and blood deficiency. What's the relationship between the Qi stagnation and blood stasis? So this is something I want you to think about. If you're not sure your answer, you can always send me an email or discuss when we are in the class. Think about the relationship and think about the reason of these points. In this video, we mainly discuss the central differentiation according to Qi and Blood. Thank you for your attention.